Thank you very much. I'm Maria Bakosova from Sandy University Hospital in Brno, Czech Republic, and Masaryk University. And I will talk about iron deficiency in patients with advanced heart failure. Iron deficiency is a very common comorbidity in patients with heart failure. More of 1 billion people of the world have iron deficiency anemia, and nearly twice of them has iron deficiency without anemia expressed. In the situation of iron deficiency, bioenergetic reserve is reduced in organs that need high energy supply, such heart muscle is. Iron deficiency occurs in more than half of patients with heart failure, and it is related with decreased exercise capacity, more frequent hospitalizations for heart failure decompensations, and according to some studies, it is connected also with higher mortality. According to guidelines for diagnostic and treatment of heart failure from 2021, there is highly recommended to screen all patients with heart failure for iron deficiency. In this group of patients with heart failure, iron deficiency is defined like a level of ferritin below 100 or 100 up to 299 in the situation when the transferrin saturation is below 20%. We wanted to find out the prevalence of iron deficiency in patients with advanced heart failure. So we included 52 patients placed on the waiting list for heart transplantation in 2021 at our center. And we divided this population in the two groups. The patients with implanted left ventricle assist device in the time of data collection as a bridge to transplantation, and patients, the bigger group of patients without LVAD implanted. And we screened iron deficiency parameters or parameters of iron metabolism like guidelines says. So let's move to the results. We can compare non-LVAD and LVAD patients. And we can see that the prevalence was very high. Patients without LVAD, the prevalence was 82%. And in the group with LVAD implanted, it was 57% of patients with iron deficiency. We can see that all women had iron deficiency. And if we are talking about anemia, we can see that anemia or iron deficiency not have to be expressed by anemia because the levels of hemoglobin are similar. And we can see that all patients with LVAD had anemia. Talking about ferritin, as the definition says, patients without LVAD implanted had low ferritin in the group with iron deficiency, but the whole group with LVAD implanted had higher levels of ferritin. And also, in patients without LVAD implanted, saturation of transferrin was low in the causes with iron deficiency, but in the group with LVAD implanted, all patients had low saturation of transferrin. So we can see the differences in definition of iron deficiency in patients with and without LVAD. We also can see that in this group, the iron deficiency wasn't related with renal insufficiency. And we can also see that patients with LVAD implanted had better parameters of kidneys, probably because of better perfusion of kidneys. So we can see that there are some differences in defining iron deficiency in patients with and without LVAD implanted. And we can see that whole group of patients with LVAD implanted had statistically significantly higher levels of ferritin. It can be caused because of chronic inflammation in the bodies of patients with mechanical support implanted. And we can say that in many situations, the diagnosis of iron deficiency based on the ferritin, like a very specific marker of iron deficiency, can be false or not correct. As in the group of patients with chronic inflammation, as oncological problems, hepatic disease, maybe hemodialyzed patients chronically, and so on. And maybe transferrin saturation or other parameters can be a better parameters to diagnose iron deficiency. So that brings us to conclusion. Let me repeat that iron deficiency was present in majority of patients with advanced heart failure. Not was always accompanied by anemia, and it was not related with renal insufficiency. And in patients with left ventricle assistant device, a false negative result of iron deficiency may occur due to chronic inflammation, because the ferritin is also the parameter of acute inflammation phase. So the saturation of transferrin or other parameters, for example, like soluble transferrin receptor, may be more precise to diagnose iron deficiency in this population with heart failure. Thank you for your attention.
Thank you for a nice presentation. So this interesting paper open for discussion. Is there any questions or comment from the floor? No, it's self-evident. So let's move on to the next presentation. Thank you.